Occupational English Test. Practice Test 3. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now look at the notes for extract 1.
You hear an otolaryngologist talking to a patient named Terry Butler. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at your notes.
Good afternoon. Mr. Butler, is it?
Yes, Terry Butler.
So your GP has referred you because of a problem you've been having with your nose. Can you tell me more about it, please?
Well, it's usually when I first wake up, I get a terrible crusty mucus, but it tends to stay around for the whole day. It's been irritating me for a couple of months, actually. I initially thought it had just resolved by itself, but it hasn't. The thing is, and I know it's a bit disgusting, but sometimes when I try to get it out, I've had a little bit of bleeding. It's not a lot by any means, but enough to notice.
Right, okay.
I've also noticed, for example, when my wife puts on perfume, it's my sense of smell. I can't seem to detect it as strongly these days, so I'm a little concerned over that. I mean, I can still breathe, of course, but it's worrying. I actually thought I was allergic to something because we'd recently adopted 2 cats, or maybe it was, I don't know, dust mites or the season, because I suddenly started sneezing. Not all day, but still quite often, regular sneezing. But that's not the case apparently. I know this condition isn't dire, but it does affect my life. The blocked up feeling can really hurt sometimes.
I'm sorry to hear it's caused you so much worry.
Well, I'm also concerned about my job. I'm a hire car driver, and it's mostly for high-end clients, so it involves a certain degree of professionalism. The last thing I need is to be seen constantly playing with or twitching my nose, or worse still, sneeze and cause an accident.
So you don't believe it's allergies related?
Well, not as far as I know. I've been to my GP, as you know, and tried to rule things out. First I had a skin prick test, and that didn't show anything, so I went away thinking it'd clear up. But then after a few weeks it was still annoying me, so I had a blood test, but that apparently came back clear. But I keep thinking maybe it's something less common, and that's why nothing's shown up. My GP asked if I'd been ill because he thought perhaps it was caused by a viral infection, but I hadn't been. He also asked if I was taking any medications that he wasn't aware of, like beta blockers or antidepressants, which I wasn't. In fact, the only thing I'd started using around that time was a nasal decongestant spray that I'd bought from the chemist, which he then advised me to stop. He thought maybe I'd been using it too much, so I did, of course, but doing so didn't seem to make a difference.
I see.
And he suggested I try a few to see if they make a difference, so I got a humidifier. That apparently helps with the dry air and therefore to loosen the mucus, which was okay, but didn't make too great of an impact. He told me how to make up a salt water solution. It's much cheaper than buying it from the chemist. I still use it now, and that helps a little too, but just not for long periods of time, so I have to keep it up a few times throughout the day. Before going to bed, he said I should take an antihistamine, but again, it just doesn't seem to last too long, and before I know it, I'm feeling the same as before taking it.
And how's your health generally?
I'm typically as fit as a fiddle. I quit smoking 14 years ago because of a number of recurring lung infections at the time. They were enough to make me wake up to myself and finally go cold turkey. As for alcohol, well, I've been having my regular nightcap of whiskey for 20 years. Always the same brand, and I always stop at 2. As I said, I'm reasonably fit for my age. I go to the gym regularly. I've been involved in a cycling club for a number of years. We're a medium distance group and average around 60 kilometres an outing, so not too shabby.
That's great.
So, do you think there could be something wrong with my nose?
Well, that's what we intend to find out. The way we do that is by performing a nasal endoscopy. It's a very thin and flexible camera.
You hear a general practitioner talking to a patient named Jane Brown. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at your notes.
Welcome, Miss Brown. May I call you Jane?
Yes, of course.
I understand you've just registered as a new patient with this practice.
Yes, I've just recently moved to the area and my old doctor's a little too far to travel.
No problem, and you've come here today because of some discomfort in your left arm, is that correct?
Yes, that's right. Well, it's actually a pain along the bone on the outside edge of my forearm. It's kind of more numb than anything and sort of spreads to my little finger. It started about 2 weeks ago, I think, and comes and goes, but there's definitely something wrong there. It's getting quite painful, especially at night. It's even caused me to wake up a few times. And sometimes if I stretch out my arm suddenly or if I bend it with any force, the pain, it's hard to describe, kind of like a guitar string being wound really tight.
Okay, and have you tried anything for it?
Well, I asked a few friends and they said it's probably a pinched nerve and to try just resting it on a pillow. So I did, but that didn't make a difference. So I looked it up online and it was recommended to put some ice on it and also a heat pack, alternating a warm compress with ice, kind of swap from one to the other and also see which one worked the best. It also said I can take anti-inflammatories, which I did for about a week, and it made very little difference. It also said I should do some gentle stretching exercises, but at the time they hurt to do, so I didn't really follow through with them.
Right, and you're 22. Are you working or studying?
I'm still at university. I'm doing a Bachelor of Science. It's my final year, so it's pretty hectic. I spend most of my days sitting at a computer.
Okay, can you tell me more about that? How long you'd spend at the computer, I mean?
Well, I'd sit there anywhere up to 10 hours or even more some days. It's pretty uncomfortable at home. We have a really large desk. It's one of those old antique things. My dad bought it at an auction. It's just that it's so high, so my forearms and I guess also my wrists have to lean against the edge of it when I type. Sometimes I sit there for a few hours and don't really move them very much. If I'm concentrating on my work, then I don't notice the kind of pressure I'm putting on them, but I often see that I have deep creases kind of halfway down my arms when I stand up, so I guess it might be quite a lot. Now that I'm saying this, it's pretty obvious that that might be the reason for the pain.
I'd certainly say it's a contributing factor. Is that the same at university?
Well, if it's a tutorial, then I sit the same way as at home because the tables there are terrible and I'm so used to it. If it's a lecture, we have those little flip-top tables so I can sit properly with my back straight because there's nothing to lean against and they're a comfortable height. I also have a question, if it's okay.
Yes, of course.
Would playing a lot of sport help this kind of injury or make it worse?
It would depend on the type and the intensity.
Well, I play netball on Tuesday nights, not for competition, just a mixed group of friends. I also swim twice a week, but about half a year ago, I joined the university rowing team. That's what makes me really feel it because of the action of my arms having to stretch and bend at the elbow so much. And that causes really intense pain. It's hard and you need to be fairly strong, but I enjoy it, so I want to keep at it if I can. That's another reason I'd really like to get this sorted out. I haven't played any sport for the last 7 days because of the pain, but I really want to get back to it. It's kind of addictive.
A break's a good idea. They sound rather rigorous. What I'd like to do now is examine not only your arm, but also your neck and spine.